We have made some progress in terms of reduction of few malnutrition indicators in some parts of the country, but we still have a long way to go. Problems like nutrition security, food security, hidden hunger, micronutrient deficiencies are haunting the country since a long time. We have to merge the programs. Multiple programs don't lead us anywhere.
Right.
There has to be a confluence, and that confluence brings the greatest force and energy to address the problem of malnutrition.
Today we have with us Dr. Chandrakant Pandav, Professor and Head of the Department for the Center of Community Medicine at the All India Institute of Medical Sciences. Dr. Pandav completed his MBBS and later MD in Community Medicine from AIIMS in Delhi and MSc from McMaster University in Canada with a specialization in health economics, clinical epidemiology, and biostatistics. He is also the founder member and regional coordinator for South Asia of International Council for Control of Iodine Deficiency Disorders since 1985. In his previous roles, he has also been the president of the Indian Association of Preventive and Social Medicine and a WHO and UNICEF consultant to over 60 countries since 1983. Dr. Pandav is also the recipient of the prestigious Padma Shri Award for his work in the area of public health. It's wonderful to have you, Dr. Pandav.
Namaste, namaskar, namaskaram.
So just to begin with, we would like to talk a little bit about your journey over the years, how you got started into the area of public health and nutrition, and how it's been so far.
First, I want to share with you my journey, how I wanted to become a physician.
Right.
I wanted to become a nuclear physicist.
Wow.
In my school.
Right.
There was a debate competition. Since my principal was from National Model School, Aga Khan Palace, Principal N.T. Nagarwala. He was a peace-loving person. He said, Chandrakant, are you going to make atom bombs and kill people? Don't become a nuclear physicist. So I took his advice seriously, and I wanted to become an engineer. But since I could not pronounce my word engineer properly those days, because I came from Marathi medium, so
Right.
my coach said, you best become a doctor. So my debate in the school was how my future career I chose as a doctor because I could not pronounce the word engineer. So I still remember Yamini from those days. I got 10 out of 10 in debate. And I still remember my speech very much.
Mm-hmm.
Before you use endless possibility around his boundless opportunity. So why should you fear? That's how I wanted to become a physician. And when I entered medicine at the All India Institute of Medical Sciences, New Delhi, about 100,000 students appeared, 100,000.
Mm-hmm.
And I was the lucky 50.
Wow.
I made it amongst the 50 out of 100,000 children.
Right.
So I joined the world's most renowned medical school, the All India Institute of Medical Sciences, New Delhi. And I got interested in neurosurgery. So I wanted to become a neurosurgeon. But my director at that time was Professor V. Ramanik Swami. He said, Chandrakant, India does not require neurosurgeons. You go to public health. So that's why I took public health as my career. And I'm so happy. And it so happened that by coincidence, I started working on the world's single most important preventable cause of mental retardation, that is IDD. So in real life, I practice public health of neurosciences, prevention of mental retardation.
Right.
See, very interesting journey, Yamini, very interesting.
It's always so great, sir, to hear from people, and when they come on the platform and they talk about how it was never their original intention to get into nutrition and public health, but now that they've been in the field and they've seen how it is, they just can't think of doing anything else. Now let's talk a little bit about your experience and where you see the nutrition scenario for India standing currently in 2021. We've just had the NFHS 5, which has revealed the progress that has happened over the past few years, as well as the setbacks. So where do you see the nutrition scenario in India, and where do we go from here?
The first fact, malnutrition has always been an issue. It's a global issue,
Right.
malnutrition. In India is no exception. So I don't like people who pointed about India's performance in nutrition. Everybody's concern. Obesity on one hand and undernutrition on the other hand. So it's a global issue, including India.
Absolutely.
So in terms of India, we have made some progress in terms of reduction of few malnutrition indicators in some parts of the country, but we still have a long way to go. Problems like nutrition security, food security, hidden hunger, micronutrient deficiencies are haunting the country since a long time.
Right.
In fact, the only successful story on a large scale is sustainable elimination of iodine deficiency disorders.
Right.
We have done exceptionally well in this area. You know, 93% of India's population is consuming iodized salt. 93%.
Wow.
The population of India is 1.38 billion. So when you say 93%, it comes to 1.25 billion.
Right.
So today, 1.25 billion of India's population is consuming iodized salt. Now, the United Nations has 193 member countries. I just did a small calculation. The population of 193 countries is 1.25 billion. So in a way, we are covering 193 countries in the world. So that is a very significant success story. Iodine deficiency disorders and universal salt iodization. And it's also a classic example of public-private sector partnership on such a large scale, not only in India, but globally. And I'm very proud that I've been a part of this success story, very proud. It's been a teamwork. It's been a teamwork.
Right, right. And I think, sir, let's talk a little bit about your experience. You're known as the Iodine Man of India because, you strongly believed in the cause of universal salt iodization. And now you've brought it to a level where we can say that such a huge number of our population no longer suffers from these deficiencies. So can you walk us through the successes of this iodization drive that you've done over the course of your career? And what
Yes.
are some learnings from your experience that we can action into the Poshan Abhiyan?
First thing is you must understand the iterative loop, the traveling loop of research to policy to program
Right.
and back to research. This is what I learned at the McMaster University in Canada, where I did my health economics,
Right.
clinical epidemiology, and biostatistics.
Mhm.
So before we make a policy statement, we have a strong evidence, research-based evidence on any question that we ask.
Right.
Okay, what is the cause of goiter in India?
Hmm.
If it is iodine deficiency, how should we control it? The famous Kangra Valley experiment. Then came the suboptimal hypothyroidism recognition. Then came the phase of screening for neonatal hypothyroidism at birth. The first global program, we did it in India.
Mhm.
I was a research associate with the Department of Science and Technology there, and I worked with the traditional birth attendants, untrained traditional birth attendants.
Right.
They were collecting umbilical cord blood on filter paper strips, and they in turn were sent to AIMS for assay of thyroid hormones.
Mhm.
So this was the first global experiment that took place in the world. And I was so lucky to be a part of that experiment. And I consider I worked in Uttar Pradesh and Bihar and Kerala and Delhi on this project. This was my open university life's learning. I learned a lot about life, especially in UP and Bihar.
Right.
And we reported the incidence of neonatal hypertension as varying from 4% to 13%,
Okay.
which is 80 to 300 times more than what is reported in Western countries, which
Right.
have effective iodine intake.
Mhm.
So when we presented this research finding to Mrs. Gandhi way back in 1983, she took a decision for universal salt iodization, and that's when the program started in 1984.
Right.
So that was a major turning point. So it is a story of research, a strong evidence-based research, policy. I learned to speak on the language of policymakers
Mhm.
and then translate it into program. But it was not a roller coaster ride. It was not a straight ride. It was a roller coaster ride.
I think it's just so inspiring to see your passion towards the cause. I mean, it's just, when you're dedicated to something so much that you eat, sleep, drink, just the same thing, like, you're bound to make a difference there. And so now, sir, let's spend some time talking about the policy bit that you mentioned, in the research policy program. Now, we've just had the government announce their new union budget and this new, Mission Poshan 2.0. So, how do you foresee that these changes are going to impact the nutrition ecosystem? And, what is the role that our platform, which is sort of to collaborate and synergize efforts, what role can our platform play in augmenting the efforts that the government is already undertaking?
Very good question. In fact, what I want to tell you is that Mission 2 is a most welcome step.
Right.
And we must take into consideration is that first we should also address agricultural security. Then you talk about food security. Then you talk about nutrition security.
Right.
So you have to get these fundamentals very clear. The other thing is that in this budget, union budget, for the first time, public health has got prominence. And within that, nutrition also has got prominence. So Poshan 2 is a most welcome step that we've been waiting so far. We have to merge the programs. Multiple programs don't lead us anywhere.
Right.
There has to be a confluence, and that confluence brings the greatest force and energy to address the problem of malnutrition. When I say malnutrition, I'm equally concerned about not only undernutrition, but also obesity. So we're sitting on a double-edged sword. On one hand, undernutrition, other hand, obesity.
Right.
So we have to have a complete and a comprehensive policy to do that. And Poshan 2 will address that particular issue. But Yamini, I just want to tell you that allocation of budget is the first thing.
Right.
Most important question is that of utilization of the budget. And that has to be closely monitored. I strongly recommend that the utilization of budget should be reviewed every 3 months.
Right.
And so that it will get a chance to make mid-course corrections.
You've made some very, very important points, sir. And especially want to highlight the point about confluence, which you mentioned was also something which was a big success of your iodization drive, which was these, public and private sector partnerships who are coming together. Exactly. So, just bringing together their pooled knowledge, their pooled resources, and, aiming for a more scalable impact. So let's talk a little bit about these public-private partnerships. What do you believe are the best ways that the private sector can step in and collaborate with the government on this mission Poshan 2.0?
Look at the private sector. The most important characteristic, unique thing of private sector is the penetration.
Right.
They reach the last person. Penetration of the markets, reaching the last citizen. Second thing is they get a regular feedback about the product. So we in Poshan 2, we'll get a regular feedback as to how well the children are doing. Today, we have the technology. I'm so proud. Today, we have the technology where we can do real-time monitoring and of real people in real life and take appropriate collective action. Right. Third thing is, it takes you to scale. Like universal salt iodization, we have reached every household in the country. So they take you to the scale. PPP also is an excellent example of breaking two important partners together, the government and the private sector. I think these are artificial divisions to my mind. They are artificial.
Right.
Actually, we are working for the people. So let's come together. Let there be a conference of ideas, expectations, experiences, and lessons learned. And let's move forward together.